Hi, everyone. Nice to see people getting on, and I see participants getting on very quickly here, so we'll give everyone just a few minutes as I see those numbers go up. So welcome, everyone, on this Wednesday that feels like a Tuesday because of our Memorial Day holiday. Wonderful. Okay, I'm going to go ahead and get us started, Sarah, because I know you have a full discussion for us all that is going to be very much needed at this time. So I am Pam Brandon. I'm president and founder of AGE-u-cate Training Institute, and we are hosting this wonderful webinar from Sarah Feifel. And she's going to be talking about how to take care of our mental health and those that you are taking care of during this pandemic. So it's, I think, just we've talked before about what a critical issue this is for everyone in our society, especially our elders. So we very much look forward to hearing you and your expertise, Sarah. For all of those of you participants that are still joining us quickly, Sarah is the Director of Education and Outreach at the National Alliance on Mental Health of Waukesha County in Waukesha, Wisconsin. And the National Alliance on Mental Health, some of you may know as NAMI. Sarah earned a bachelor's in social work degree from the University of Wisconsin-Whitewater in 2011 and earned her master's in social work with an emphasis in mental health from the University of Wisconsin-Milwaukee in 2014. She has experience in working with various populations, such as those experiencing homelessness, substance abuse, or concurring issues, and adults with mental health conditions. So Sarah, welcome, and we look forward to hearing what you have to share with us today. So I am going to turn it over to you, and I'll come back right at the end, but for now, I will turn off my video and mute myself so you can take over. So
Awesome.
Welcome, Sarah.
Sounds great. Thank you, Pam. I appreciate it. And thank you, everybody, for having me and being here. I'm looking, and it looks like we have about 47 people. I know some others are trickling in, so thank you very much. I do just have to say that sometimes doing these online presentations and webinars can be a little weird for myself and probably for you on the other end as well. So I want to try to make it as personal as possible. I realize that we don't, looks like we don't have people's videos on, which is totally fine. So please, if you have any questions throughout this, please feel free to put it in the chat box. You should be able to see the chat box. There's a bar in the lower half that'll say participants. Click on participants and click on chat, just because then you'll be able to see kind of everything that's going on. But without further ado, I will start sharing my screen. And the first thing that I want people to do is I want people to type in the chat box what state you guys are from, just because I'm from Wisconsin. So obviously I'm going to be speaking from a Wisconsin perspective a little bit, but I also adapted this presentation so more people nationwide can make use of it. Since I'm presenting, I just got to figure out my screen. Oh yay, a few Wisconsin peeps, all right. Massachusetts, North Dakota, Texas, Minnesota, Pennsylvania. Awesome. Kansas, Virginia, Colorado. Awesome, awesome. Texas, California, perfect. So welcome. So everyone should be able to see my screen with just the PDF, correct? I just want to make sure. If somebody can just type yes for me, that would be great. Thank you. All right, so today I'm going to be talking about, how to take care of your mental health and those you take care of during COVID-19. I'm not going to get into the specifics as far as, you know, how to protect, right, how to protect from the disease itself, right? I'm not going to be talking about that. I'm not going to be talking about lots of COVID kind of numbers and things like that, because believe it or not, a lot of the things that we're experiencing right now during this kind of quarantine or isolation, this pandemic, is a lot of what people experience that already are living with mental health conditions. So I've heard from multiple people that live with their own conditions that say, you know, others are starting to feel like how I feel every single day. Just kind of like this uneasiness, this unpredictability, right? So a lot of the things that mental health talked about, you know, before still really applies during this time. It just means that we really have to pay attention to it more. And does mean that it's more work on our part, because we have to do stuff. We have to implement something. We have to implement some sort of routine, right? And the good and the bad. So I'd like to start off with just these few cartoons. So never in the history of calming down has anyone ever calmed down by saying, calm down, right? And that comic on the bottom too of saying, you know, I'm having a panic attack. Person just says, calm down, right? Oh, it worked. And then, you know, oh my gosh, we're entering this post-medicine era or this post-medical era, right? Well, the fact of the matter is, right, it's a little bit more complicated than that. And to remember that you aren't alone. More than ever, we need to find ways to stay connected during this time, and for whatever the future holds too. This is kind of starting a lot of conversations with people, just as far as what does their work look like moving forward. You know, do we start to do more stuff online? Do we like this remote work stuff, right? So there's a lot of different things. So mental health, right? So when somebody asks me to do a presentation on mental health or about awareness, education, how to take care of yourself, how to take care of others, right? There's a lot of different things that means. So this is just kind of a word cloud of just all of these different kind of words, some words that people may think of when they think of mental health, right? So they may be thinking of wellness, right? Or just maybe mental health awareness. They may be thinking suicide, right? Depression, any phobias, right? Bipolar disorder, right? Treatment, all of these different things. That is all part of your mental health, right? And then some. So before I kind of jump into the mental health side of things, I do want to tell you a little bit about what NAMI is. So I am from NAMI Waukesha of Waukesha County in Waukesha, Wisconsin. And yes, there's a lot of people from Wisconsin on this call, so I was going to make a joke about my accent, but I think I'm in some good company. So yes, I realize I probably do have a northern accent. And whether you call it NAMI or NAMI, either way it works. I say NAMI. Some people in the South say NAMI. I've heard people also in Wisconsin say NAMI, so no worries there. So NAMI Waukesha, we are an affiliate of NAMI, meaning, and we're a local affiliate. So I put in here, so NAMI, just in the blue, right? That's big NAMI. They are the ones that make all of our programs, do all the research and evidence-based stuff, right? And then every state has a NAMI state affiliate. So that's NAMI Wisconsin for me. And then in every state, there's local affiliates. So then I'm a part of a local affiliate. We are very fortunate. We're the second largest affiliate actually in our state. So that means that we have a lot of signature programs. I'm going to get into a little bit of some of our signature programs. And that means we have paid staff. There's a lot of NAMIs that still exist on a volunteer basis because NAMI is actually the largest grassroots mental health agency organization in the United States. We were actually founded in Wisconsin, which was kind of cool. Something I did not know until I worked for NAMI Waukesha, full disclosure. But it actually started in Madison, Wisconsin, and it was a table of moms that had adult children with schizophrenia and bipolar disorder in the late 1970s. So as you can imagine, during that time, there was a lot more stigma than there is now. And the stigma then was basically there's not a whole lot that can be done. There's basically one sort of treatment, and it was usually medication. But these family members, these moms especially, were left with, but what do we do? Like, how can we help? Like, what's the prognosis? They didn't have any support for each other. And at that time as well, there was a lot of blame being put on the parents, and especially the moms, saying it was your fault, you weren't parenting correctly, or whatever it was. We know that that's not the case. We've learned a lot since then. But how NAMIs then were born was that those moms around the table decided, hey, we're gonna put together a all-day or multiple day conference, like NAMI, or at that time it was AMI, the Alliance for the Mentally Ill, because it wasn't nationalized yet, right? So they said, well, let's put on a conference and see who comes. They were maybe expecting a few dozen people just to try to kind of get this kind of coalition of people together. And actually over 250 came. 250 people came from across the country. Even a few people from Canada came. So they realized, like, hey, this is something big. So they came together at that kitchen table, they came together at that conference, and then everybody, went back to their states, right? And then started their own local AMIs, the Alliance for the Mentally Ill. So then it became nationalized. So I just want to kind of explain some of that, that background, because I think it's important to know just some of the history. And that means too that we were founded by family members, meaning we're founded by people with lived experience that are there to say, hey, we're family members. We're people that are going through it ourselves, whether it's with our loved one or personally, right? We can speak from that lived experience. We can speak from, hey, this is where I've been. This is what's helped me. I don't know if it's going to help you, but this is what I've learned through my journey, right? So our mission at NAMI Waukesha specifically is to inspire the hope of recovery and deepen the understandings of mental health conditions for individuals, families, and communities. So we do that by doing different education support and advocacy programs. And in 2018 and 2019, in those calendar years, we had over 13,000 points of service. That's probably lowballing it, because even though we're the second largest affiliate in the state, doesn't mean that we have all the bells and whistles as far as data collection. Data collection is very difficult. We're still considered a small to medium-sized nonprofit, so still kind of chugging along. Oh, and I also mean to say too that since we're our own nonprofit, we're our own 501c3, meaning we have not only signature programs, but then our affiliate has even more programs beyond that, basically. So what makes us qualified, right? So it's kind of the lived experience. My history, it happens to be with my schooling of social work, right? So that's kind of how I came into this NAMI world is I wanted to help people. I wanted to primarily be a case manager. That was kind of what my trajectory was. I didn't want to be a therapist. So some of you are maybe thinking, well, why did you get your master's in social work, right? And at that time, I probably didn't know quite so, but I was working at NAMI. I loved doing what I did and advocating, meeting with people one-on-one. And we're just a huge support system for people. A lot of times we're the first stop shop for some people that have gotten newly diagnosed with something, or their family member was diagnosed with something. They want to know more about it, right? So we're kind of that first stop for a lot of people. And specifically then what kind of makes us qualified even to talking to, AGE-u-cate, right? So aging population folks, which is you guys. We do NAMIs across the nation actually facilitate a crisis intervention training called CIT for patrol law enforcement officers. So since 2011 in our state, we have trained over 400 officers in Waukesha County. So what this training does, it's a 40-hour training that officers oftentimes opt into, saying, hey, I want to be a CIT officer. And what that means is they're going to be able to understand mental health conditions a little bit more, be able to identify a psychiatric crisis better, and not only psychiatric crisis, but then the difference between psychiatric and maybe this is somebody going through a cognitive issue, whether that's autism, maybe it's dementia, maybe it's a memory issue, right? So we were actually fortunate enough to facilitate an advanced CIT then, which was a one-day dementia summit for CIT officers that were either previously CIT trained or never CIT trained before. So, and that's really kind of some of pairing with some of our local initiatives to be dementia friendly and dementia friendly communities and things like that. So there's that. So what is mental health, right? What is a mental health condition? So if you look at all of those the word cloud from before, right? That's all mental health stuff, right? It's really hard to kind of put, I think people a lot of times want to have more of a concrete definition on what is a mental illness or what is a mental health condition. And really that definition is, it's a condition that affects the person's thinking, feeling, or mood, right? Or all three of those, right? So taking that into consideration, it doesn't include memory. So when we're talking about a mental health condition, at least from NAMI's perspective and a lot of people's perspectives, right, there are kind of silos in a way of those types of things, but I want people to understand that it's, when we are talking about a mental health condition or a mental illness, we're not necessarily talking about other brain-based disorders like autism, like dementia. However, we know that there are plenty of people that live with autism that also may live with a severe anxiety disorder, or may live with dementia, like a later in life dementia, but they lived with bipolar disorder before, right? Prior to getting later stage dementia, right? So there's all of these different types of things. They're co-occurring. So the two images that I have for you, and I apologize that the one of them might not be big enough with the colored boxes. You will be getting copies of this afterwards, just so everyone knows. But there are biological influences and factors, right? There's also psychological influences, and then there's social and cultural influences, right? So which could, potentially cause this disorder or this condition. So a lot of people want to know, well, why? Why do people get mental illnesses? Like, what's the cause? And there's a lot of stuff to consider, right? Sometimes, so when we're talking about biology, right? Your genetic makeup, you cannot change that, right? You don't get to pick who your parents are, you're born. And then sometimes just kind of the brain structure that's developed. So no genetics involved, but just how then you develop as a baby, right? That has an effect on your brain. And then when we're talking about psychological influences, right? So responses to stress, patterns of negative thinking, maladaptive, aka bad coping skills, right? And then just kind of like even environmental factors and social factors. So, stigma and prejudice, even like how it's looked at in your family growing up. I know for me and my family growing up, we didn't really talk about mental health. I, later found out that there are people in my family that live with mental illness. And just because I represent a local affiliate of NAMI doesn't mean that my family's perfect and that we like to admit all of this types of stuff and talk about it. However, I can kind of try to start the conversation and use what I know to help my family members. So I'm really hoping that I can spread some of this knowledge to you guys so that you can learn a little bit something that you can take home or investigate more of. So that the third image then, there is actually a brain scan. There's two different brains. The normal is the control. I don't like that it says normal, not like it's like a normal brain, right? The normal is that control brain, right? Somebody that does not have depression. And then on the right, there's the depressed brain, somebody that has depression. So just based on the colors of what you can see, right? Basically all of those lime green and lighter blue areas in that control brain, they're lighting up more, right? It's lighting up their brain more and all around the brain too. The top of the image is the front of your head. So that's where we make a lot of decisions, a lot of judgments, right? Which, as you can see then, literally in these scans then, the person that has the depressed brain, right, and that frontal lobe, it's not lighting up as much. So when we tell people, it's not as bad as you think, or just get over it, right? If somebody really truly is struggling with the condition, this is medical. This is happening in the brain, right? Everybody has mental health. Everybody has brains, right? But we don't all have a mental health condition. So yes, there are definitely ways mental health wise that any person can cope with and kind of get themselves out of a funk. However, that's a little bit different when we're talking about kind of clinical depression or any kind of clinical, mental illness, right? So also, when I talk about mental health conditions, right, it includes all of this list and many more. And you'll notice that I'm saying mental health condition and not so much mental illness, but I'm trying to interchange them a little bit because mental illness, right, there's a stigma on that word in general, right? Like, ooh, mental illness. We see that word in the headlines, right? So mental health condition, I think that it makes it a little bit more broad because when we are talking about those conditions, right, we're talking about mood disorders, we're talking about depression, bipolar disorder, we're talking about stress-related disorders like anxiety, post-traumatic stress disorder, obsessive compulsive disorder, right, and schizophrenia or schizoaffective disorder. So schizophrenia looks a lot different than somebody with major depression, right? However, they are kind of grouped in to the same category because they're mental health conditions. However, that's not saying that obviously they're not the same. But the other thing that I always want to mention is that, you could do all this research all day long and, look at all of these conditions and everything like that. But the biggest thing is to tell people, to notice, to understand is that they're treatable. A lot of times we don't talk about how these things are treatable, how they are possibly manageable. And you can't do it by yourself. If you're expecting that you can, it's really, really tough. And during this time, it can be even tougher. So another example of kind of why during this time that people that have experienced mental health stuff before are kind of, some people are better or okay during this time. Some people are getting a little bit worse. But they kind of know how to navigate a little bit of this being socially isolated or that sort of thing. But we're all kind of in this together and trying to navigate this, right? So recovery is possible. Just because you have, somebody that has bipolar disorder doesn't mean that it's this one image in your mind. Before I get into that, because when we're talking about mental health conditions, right, I want you also to realize too, and I'm not going to get into symptoms of each type of thing because that's stuff that you can look at on your own. And I'm not here to diagnose. You're not here to diagnose. You're not going to leave here a therapist or a doctor, right, or anything like that. But keep in mind, if you know somebody with bipolar disorder, right, you just know that person and maybe how their symptoms are. Two people with bipolar disorder or any illness, right, can look very different. Their symptoms can look very, very different. There's some overlap, right? But just kind of keep that in mind. It doesn't just look like this one thing. Because a lot of times, we get told or we get asked, at NAMI, well, my aunt has bipolar disorder. She's been stable for 25 years. Like everybody should be able to do it, right? I hope so. I really, truly hope that everybody can achieve the recovery that your aunt has achieved, right? However, if we could give a magic pill to everybody, right, and it would work for everybody, right, we wouldn't have these types of issues. And that's just, it's a lot more complicated than people think. So something to keep in mind, right? So when we're talking about mental health conditions, maybe thinking, that doesn't really affect me, right? But it does. So it actually affects 20% of the US population. So in any given year, 1 out of 5 people are going to experience a diagnosable mental health condition, right? And actually 1 in 25 US adults experience a serious mental illness. Now, that's a serious mental illness is defined by basically severely inhibiting your ability in one of your activities of daily living. So whether it's, you can't, I don't even want to put any examples with it, but typically, now this isn't everything, but typically that 1 in 25 with serious mental illness is usually individuals living with schizophrenia or bipolar disorder. Typically those are just kind of the more, they're the more stigmatized. 2, I think they're more difficult to diagnose and also for somebody to maintain treatment, especially because with schizophrenia, one of the symptoms is basically having delusions, right? So having this mindset, these beliefs in something that's not actually true. So meaning they may be thinking, they may be having really severe paranoia around the government following them, or that they're afraid that the government's going to hurt them or someone's going to hurt them, right? That's an example of schizophrenia. Why was I going with this? The 1 in 25 people with serious mental illness. This is what I'm saying, guys, as far as speaking to an audience that's not there, but I know you're there, right? So that serious mental illness, typically those with schizophrenia and bipolar disorder, it's harder to treat. People with schizophrenia, if they have those delusions, they often believe they're not sick. That's what causes people then to not get help, right? As quickly as I would hope they would, right? And especially somebody like that, you know, I'm sorry that I don't have a brain scan of the people with schizophrenia, because actually there's a lot of research going out right now as far as even what is schizophrenia. They're possibly trying to reclassify it right now, because it does look so different. Not only with symptoms, but it does look different in the brain and how it's treated with medication and everything like that. So not only does it affect adults, it's also affecting our youth. So 17% of youth ages 6 to 17 experience a mental health disorder. So yes, when we're saying age 6, yes, we really do mean that, even possibly younger than that. And there are kids as well as adults that have thoughts of suicide. That is a real thing. That's not something that anyone is making up. Again, kind of goes back to those 3 different components, right, of what can cause this mental health condition. But then just some of the statistics that you probably are looking at while I've been talking. So just kind of the 12-month prevalence of common mental illnesses in the United States. So 19% of the United States has an anxiety disorder, right? We go up to the next biggest is depression. And then it is post-traumatic stress disorder and dual diagnosis. Dual diagnosis is often referring to people with co-occurring substance use issues as well as a mental health disorder. And then 3% having bipolar disorder and 1% actually having schizophrenia. So I kind of like to talk about schizophrenia in a way because it's really stigmatized, and it's more common than people think. And it does take a lot of wraparound care in order to be able to help somebody with schizophrenia, oftentimes. Not every time, but oftentimes. So then also, right, when we're talking about older adults and mental health, depression is not a normal part of aging. So this isn't just something like that we should all be, you know, quote unquote, looking forward to, right? Like everyone's going to get older, right? We all get old. But depression's not part of that. You shouldn't, if you're having signs of just kind of that sadness, that feeling numb, crying spells, maybe thoughts of suicide, maybe not, right? Trouble sleeping, trouble eating, so clinical depression, right? It's not a sign of, it's not a normal part of aging. So that being said, for those 65 or older, who have subclinical depression, meaning like their symptoms don't quite meet that threshold, that approximates about 1/4 of that geriatric population. So there are older adults that do experience, depressive symptoms and depression, right? But they may not be experiencing it to a diagnosable level. They may be just experiencing it at kind of a normal level. Because let's be honest, depression and being depressed is an emotion. We have all experienced sadness. We've all experienced times of being depressed, but not all of us have experienced having that as an actual condition, right? So the World Health Organization reports that late life depression affects 7% of older people worldwide. and that 90% of seniors don't receive adequate care for depression, which unfortunately I don't think is surprising, and with 78% not receiving any kind of treatment at all for their depression. So I say this to say that it's not a normal sign of aging. However, they can experience that. And just because somebody is aging doesn't mean that all hope is lost, right? There's still treatment. There's actually geriatric psychiatry as a specialty, right? It's not, as abundant, I think, as just general psychiatry, but it's there. It does exist. So the ripple effect of just kind of mental health, right? How does this affect everybody? Because again, you may be thinking, this doesn't really affect me, but this affects me in my work life because I work with individuals, right? But not really, because when you're thinking of the person themselves, 20% is living with a mental illness, right? People that have serious mental illness do have an increase for chronic disease like diabetes or cancer. And that's awful. It really sucks. I don't think it's on this slide, but actually individuals with serious mental illness, they actually pass away on average 25 years younger than their peers. And oftentimes it's due to preventable illnesses that they could have been treating or managing, I should say. So whether that's diabetes or whether that's heart disease, but sometimes it's also because sometimes when people are going into the emergency room and they may be having a heart attack, right? They're having palpitations. They feel awful. They feel sick, right? And sometimes, and I've heard of this experience from others. They go into the hospital. They see that they have anxiety in their chart or panic disorder in their chart, and doctors will say, "Oh, well, you're having a panic attack. This is anxiety, right?" So then they don't get treatment right away as far as looking at more of the heart. Now, I say that to say people have those experiences, and sometimes they are having just a panic attack or, quote unquote, just a panic attack. But for that person, it's really scary. They can't control it, right? If they could, they wouldn't be there. Or they really don't know what to do. So that's why they're at the emergency room, because they're having a medical emergency, right, of some kind. But then not only does it affect that person, it affects their family member and kind of their network of people, right? So caregivers spend an average of 32 hours per week providing unpaid care. And what does it else say? At least 8.4 million Americans provide care to an adult with an emotional or mental illness, right? So when we're talking about, oh, this isn't just like, oh, this isn't me, right? There's 8.5 million family members that are taking care of people that have mental health conditions, right? So it's affecting people. So not only does it affect that family network, it affects the community then too, right? I talked about those emergency room visits. So 1 in 8 of all visits in the United States in emergency room departments are related to mental health or substance use disorders. So whether that is detox, whether that's a suicide attempt, whether it's, somebody that has bipolar disorder, they're off their medication, they understand that, and they're going through a big manic episode and they know that they need to check themselves into the hospital, right? So not only in the community then too of how it affects 20% of people experiencing homelessness also have a serious mental illness. We really believe that number is pretty low, but it's what we got, right? 70% of youth in juvenile justice systems have at least one mental health condition. So what does this mean, right? I mean, it means that it's affecting it's affecting more people, I think, than we think, and it's affecting more systems than we think. And then worldwide, actually, depression is actually the leading cause of disability worldwide. So, and I believe, depression and anxiety disorders, they cost the global economy $1 trillion each year in lost productivity. So when we're just talking sick days and that sort of thing, right? Depression and anxiety, that's a huge amount, right? It's the leading cause of disability worldwide. So this is no joke of what we're talking about. But what I like to highlight is there's always hope, right? So just some images of people that are, you know, kind of idols to me in a way, and enough that I know enough about them. I can talk about them a little bit, and I can talk about everybody in this image. But these are examples of, you know, famous people, right? People that are in the public eye, famous, right? There's Abe Lincoln, the famous president. These are individuals that are living with their own diagnosed mental health condition. There's Lady Gaga. There is Catherine Zeta-Jones. She lives with bipolar disorder. Lady Gaga, she lives with PTSD, depression, and eating disorders. Will Wheaton, he is an actor and writer, and he lives with pretty severe depression and anxiety. Same with Kristen Bell. She's a huge advocate for mental health, as well as Will Wheaton, huge advocates. And then the gentleman that is holding up a sign that says, "I have BPD," that is Brandon Marshall. He was a football player in the National Football League in the NFL for the Bears, and I believe he played for a few other places as well. But BPD is borderline personality disorder, and he no longer plays in the NFL, unfortunately. But he used kind of the NFL and his platform of being a player to speak up about mental health. He was actually then in the news, I think this happened in like 2013, 2014, I want to say, where he wore lime green cleats during May, which is Mental Health Month, right? So, and that was against the code. So he was actually fined, I think it was $10,000 or $15,000 because it was against, you know, the code. Well, he said, I would gladly, you know, I'll gladly pay the fine, but I'm also going to donate that same amount to my foundation that brings awareness on mental health, right? So then he spoke about, like, yeah, I live with borderline personality disorder. This is how getting this diagnosis has even helped me, and I've realized these certain things, and I'm not alone, and, you know, right? So it's starting that conversation. He's using that platform. So I should also say that, yes, May is Mental Health Month, and I forgot to do that in my intro. That's the reason why I'm wearing a lime green ribbon. Lime green, or kind of a medium colored green, that's awareness color for mental health, in case you didn't know. But I did want to talk just a little bit about some NAMI programs and kind of what you can expect. I'm going to be talking about, right, so I talked about my affiliate and some of the things that we do. So we actually hold, I think, pretty much all of these programs, and then even more so. So we even do like some suicide prevention work. We do some youth mental health first aid trainings, different things like that. But just as an idea for you is some programs that you can look into then after this phone call and going back to your communities, since you guys are from all over the country, right? So education programs. So there's education programs like Family to Family. So it's a course for family members to take, or caregivers to take, to be like, what is my loved one really going through? How can I really actually help? Because oftentimes family members, I believe, firmly, truly believe that they're helping their loved one by, you know, doing the tough love thing. And there is a time and a place for tough love, but if that's the only tactic that has you know, been happening, I can almost guarantee you, you haven't seen any progress in that person, right? There's probably a reason for that, and it's based off of how we're reacting to those loved ones. So we mean it out of a place of, we're here for you, we want to support you, or I think that me telling you what to do is helpful, right? That's what you need. You just need to know what to do and you're going to go and do it, right? But no, oftentimes that's not the case, right? So we have programs, or NAMI has programs for family members. NAMI Basics is actually for parents then of school-age children that are going through emotional difficulties, mental health related, right? All of our programs and services are free of charge. Thank you very much for somebody for asking. All of our signature programs will always be free to the participant. So that's a huge benefit to our programs, is that this is free education. There are some programs out there that are really good programs, you know, but they charge money. And if you're looking for something that's free, that's easily accessible, and that's taught then by people with that peer experience, with that lived experience, you get a way more well-rounded program and well-rounded education. So for our family education classes, they're taught by family members. Our peer education classes, like peer-to-peer, they're taught by peers. They go through a training and everything like that. Ending the Silence is actually in high schools. We teach it in health classes. NAMI Inner Own Voice is a program that is for individuals that live with their own illness that are there to talk about it then, that can kind of explain, you know, here's where I've been, here's what I've done to, you know, to get me well, here's what I keep doing to keep me well, right? CIT that I had mentioned before, that crisis intervention training for police officers. NAMI themselves does monthly webinars with mental health experts. That's awesome. And then NAMI also has support programs. So whether that's phone calls, walk-ins for local affiliates or state affiliates, I'm going to get into resources a little bit later, so hang tight. But there's also support groups then for family members and for peers. At my affiliate, we even have a parent peer support group that's been fortunate enough to be meeting online. And then NAMI.org themselves has online discussion groups. So you may be thinking, oh, well, I have a really specific situation. You know, look for that specific situation in the discussion groups, because somebody most likely is probably talking about it, right? So enough about NAMI. I'm going to talk a little bit about it later too, but I wanted to kind of get into taking care of your mental health, how you can help yourself, how you can help others, right? So I like this image of that empty cup, right? You can't pour from an empty cup, so you need to take care of yourself first. If you're thinking, you know, I can conquer the world, I can take care of whatever, I can do it all, you know yourself more than anybody else. However, you can't physically and emotionally be able to take care of somebody without being well yourself and being in a place that you can take care of that person, right? So some things that I need you to kind of keep in mind during this time, right? So this kind of control, the things I cannot control and things I can control, sometimes it's called locus of control, right? So the things that you can't control, right? Such things as like the actions of other people, how other people are reacting, how the whole COVID-19 thing is going to last, right? You can't control the amount of toilet paper at the store, right? You can't control other people's motives, right? But what you can control, right, so those things that you can't control, you're going to try to let go of those things because you can't control those. And especially at a time like this, you need to be focusing on only the things that you can control, because that's honestly what's going to get us through this, is being able to focus on those things that you can control. So you can control, right, that physical distancing of people. You can control the fun things that you're doing at home, or being physically distant, right? Like going on a walk, right? You can turn off the news. I'll say it again, you can turn off the news. You can limit your social media intake. You don't have to be looking on Facebook all the time. I've known some people during this time, they've actually removed it from their phones. They're like, I don't want to do this right now, right? You can control your positive attitude or outlook on things, right? Saying, I can't control what other people are doing, but I'm doing what I can do right now, right? I'm thinking positively about it. You know, I can only control that. So why am I so, worked up about it, right? And these are things that even myself, I have to realize these things, of the things that I can control, right? So a lot of what I'm going to be talking about is actually coming out of the Compassion Resiliency Toolkit that was actually created by WISE, which is the Wisconsin Initiative for Stigma Elimination. And this is also free of charge for people. They have awesome toolkits for parents and caregivers. They have a toolkit for healthcare providers or human services field. And then they have a toolkit for something else that I can't think of right now. I think maybe school professionals, I want to say. So they have 3 main toolkits. A lot of this stuff you can take some stuff from and apply it to your life, even if you aren't in one of those categories. But they also then debuted this Staying Resilient During COVID-19, which is kind of a condensed version of their Compassion Resiliency Toolkit. So I'm going to be going through some of that during this. So yes, somebody had said, can you email the website to us? Yes, you guys will be getting this full PDF. So you'll be able to, and you can click on it right from the PDF, or you can copy and paste it too. So that should work. It's awesome. So this is actually a snapshot of the page itself. Each of these, right, categories, so stages of fatigue and self-compassion, the locus of control that I just mentioned, right, expectations, mindfulness, stress awareness, gratitude. Those are all things that you can look into. So each of them has like a 1 or 2 page handout, and then also has a video that goes along with it. And these videos are 8 or less minutes. So, and it gives you just kind of a good quick kind of go-to of what to be thinking of during this time. So some of the takeaways that I want to share with you is focus on what is, right, rather than what is lost or what the future may hold. So that goes into that locus of control, going back to that Fox graphic, right, of what you control versus what you can control versus what you can't control, right? One sure way to fall into compassion fatigue for ourselves or others is to have unrealistic expectations. So expectations are huge, especially during COVID-19 and this pandemic. So your expectations can set us up for growth, joy, adventure, or for disappointment and sorrow, right? So it's all about, you know, what is that expectation? And also just about kind of compassion resilience and compassion fatigue for maybe some of you that haven't heard those terms before. Compassion fatigue is something that if you are in the helping profession, whether that means you are a therapist or a doctor, maybe you're a CNA, maybe you're a nurse, you're a caseworker, right? Anything like that, any sort of helping profession, even teachers, right? There's a sense of eventually, most oftentimes, everyone goes through compassion fatigue, basically meaning you are putting in your all emotionally. And it can be then emotionally and physically draining for you. There has to be some sort of balance. There's a reason why, you know, there are policies and procedures. There's a reason why there are practice standards and those types of things. Because, you know, you do want the best for your client. You want to see them succeed. You want to see their strengths. And just doing that natural work that we do, we can get a little bit bogged down by that and literally fatigued by it. You know, we start kind of, and the compassion resiliency toolkit kind of goes into this. It goes into, you know, you can be a zealot, meaning like you're super gung-ho. You're like, I'm going to conquer the world. I'm going to help every single person. Everyone is going to be a success, right? You know, I know what people have been doing wrong, so I'm going to be doing it this different way. I'm going to have all the success, right? You can keep doing that, but you'll burn yourself out, right? So compassion fatigue is another word for burnout. So if you're thinking to yourself, or if you've heard the term burnout, you know, in social work field, in the helping profession field, right? That's the same thing. Compassion fatigue is the same thing as burnout. So that compassion resilience then is being able to stop yourself from getting to that fatigue stage. Now, you may be thinking, oh, I'm already there. I'm already at that fatigue stage, especially depending on what your role is right now during this time. This toolkit is a way to try to, you know, teach you kind of some of those things, some of these things, right? Boundaries, expectations, gratitude, because that is the stuff that we need to be focusing on in order to keep ourselves well during this time. If you're thinking to yourself, ugh, there's no way, no, this isn't going to work for me, it's a bunch of hooey, right? Don't knock it till you try it. And also, if you're thinking that way too, chances are you're going to keep feeling the same way that you're feeling. If you find something else that works, share it with other people, right? Find what works for you. So also, steps to compassionate action. It does talk about this in compassion resiliency, but I think during this time when we're talking about, other people are talking about COVID-19, right? Talking about isolation, talking about differences in what their work schedule is, differences in, you know, maybe they did lose their job, right? All of these different things. And you're in this helping profession, you're working with somebody one-on-one, or also you're using this for your personal life too, right? So if you're thinking to yourself, okay, you know, I don't think of myself as a compassionate person. You know, sometimes there are more of the boots on the ground people, right? More of the direct service people that have lots of that compassion stuff, but then maybe your boss doesn't really get it, or then the next higher up doesn't get it, right? This can be able to then help in any of those types of ways, right? So just trying to respond in a compassionate way is kind of what we need right now, and is usually what people need during any sort of kind of stress. So one, you're going to notice. You're just going to be present and notice whatever they're telling you. So you're not going to react, right? You're noticing your own feelings, right? So just being present that, wow, somebody is venting to me, right? Or maybe somebody is talking about, you know, how they don't want to wear a mask or whatever. And you have all of your opinions and thoughts and feelings, right? So you're just going to you're just going to be present, notice that that person is in distress of some sort, right? You're going to do a self-check then of being aware of how you're feeling in the moment, right? About that other person's struggle. And then the third thing you're going to do is you're going to seek some sort of understanding, right? So trying to get that somebody else's perspective of why, you know, why they have those thoughts. Why are they saying this? Why are they venting this to you, right? And, you know, then the next step is kind of cultivating some sort of empathy. You know, it comes from that common place of a feeling, right? Whatever it is. So the example I put down is frustrating, right? So you may be just really frustrated, like maybe somebody's bringing something up, like you're like, oh my gosh, I've had this conversation with you, or even with, you know, with multiple people before in this past week. I can't have this conversation one more time. If you follow these steps, it's honest, it kind of makes you take a step back from the moment and just be like, okay, this is somebody that's struggling, right? I'm noticing that. I'm self-checking. I've had 12 people talk about this with me already. I really hate to have this conversation again, but here it goes again, right? You're just being self-aware. You're like, that's what my true feeling is, right? But you're going to seek that understanding. You're going to hear them out, right? You're going to cultivate some empathy, which is, you know, maybe like, oh my gosh, that sucks. That's empathy, guys. Simple, right? Little things. You don't have to solve all of their issues, all of their problems. But then just figuring out what those next steps are, right? You know, what do you think you're going to do next? Or, right, put it in their court as far as, you know, what do you think the best action is, right? So this can't work for every single situation. I realize that, but this is just an example of kind of some steps that we can take towards that compassionate action. That's not only helpful for the person on the receiving end, but then is also helpful for ourselves, because we're being mindful of like, okay, we're noticing that they're struggling. I'm going to self-check myself, whatever those thoughts and feelings are. I'm not going to tell them that. That's just what my self-check is, right? And then you're going to continue. So you may be thinking to yourself, okay, I might be struggling during this time, or I came onto this webinar because, you know, I know my friend is really struggling and I don't know what to do, right? Going back to kind of that word cloud of mental health, right? It's really hard to kind of come to a presentation and kind of get everything that people are wanting out of it. But I really hope that some of this speaks to you in some way. So please, I want to encourage you to seek some sort of support, some sort of help, some sort of guidance, right? And that doesn't just mean one thing. This doesn't just mean, calling your doctor. It doesn't just mean, that you're going to see a psychiatrist, right? And sometimes that word is scary for people, right? But keep it in mind, these are medical professionals. And if what you're truly experiencing is a mental health condition, this is an illness of the brain that is treatable and it should be treated, right? So something different is going to work for everybody. Treatment in any way, right? It may or may not include medication. Something to keep in mind when you're talking to some people. Sometimes when people think treatment, the only thing they think of is medication. They say, no, I don't want to be on medication for the rest of my life. And you're like, I didn't say medication, right? So it's just kind of the educating about what is out there, and even trying to help walk with that person, figuratively or literally, to be able to get to that next step closer. Starting with your primary care doctor, if you really think something is going on that's diagnosable, um, that's really being a detriment to your life right now. Or maybe something was going on a little bit before this COVID-19 stuff happening, and you were coping. You were like, okay, like you were stressed out. It was, one of those things, right? But you were coping, you were doing okay. But then now this COVID-19 happened, and that flipped a switch for you. And now like you're unregulated, you can't cope how you used to cope, right? And keeping in mind too, that can happen too for a lot of students as well. Sometimes school is their safety net, is their safe space, because they do get to see their friends, or they do, it could be a good or the bad thing, right? So to keep in mind that maybe then during this time, oh my gosh, I don't have my school, so I don't have my safety network. I don't have that one teacher that, cares about me. And, maybe that student is thinking, oh, and my parents don't care about me, or whatever that case is, right? Another option is just talking honestly and openly with a friend or a trusted family member. And, I do want to say that you may not get the reaction that you're hoping for the first time or the second time. I can't promise you that. But what I can promise you is that there are people out there that are willing to listen to you, and that people that really do understand and that are going through it. So find those people and keep asking for help and understanding from different friends and family members until somebody is willing to listen, and until somebody is willing to say, oh my gosh, wow, like I didn't realize you were going through that. Like, tell me more about it, right? Rather than like, oh, I don't know what to do with that. Like, good luck, right? It says a lot more if you're willing to literally or figuratively walk with somebody, right? Texting 741-741 for support 24 hours a day. Now, this is a nationwide line, and you can text anything, any word to 741-741. Even if it's just a period, it's going to send to them, right? This is for crisis support, normal support, suicidal or non-suicidal. This could be for somebody that's going through it themselves, or maybe you're like, I don't know how to help somebody else, and I need to be able to talk to somebody, right? That's what that number is used for, that text line. Check out notalone.nami.org. That explains a lot of, it shares people's stories on there. So if you're thinking to yourself, oh, I don't really know what Sarah's talking about here, right? Or I don't know what these mental health conditions really are. I want kind of some of that lived experience. Go to that website, go to nami.org even, and search that website generally to educate yourself on these things. Because oftentimes we think we know how to help a certain something, or we think we know, well, yeah, if you have depression, of course you're going to go to your doctor, and they're going to maybe recommend you go see a therapist, and maybe, you try that out, or whatever it is, right? Educate yourself. That might not be the only thing that's out there. There are way different things that are out there. You have to find them. So kind of some more tips and suggestions just in general, which some of these are, sorry, I didn't think of any, there's nothing that's out there that's like brand new, right? We're kind of using the same things that we've always kind of used, right? So, engaging in a hobby of yours, right? I'm sorry if one of your hobbies is, doing contact sports with people, and you're not able to do that right now, right? But being able to then just exercise in general, go jogging, right? Those are things that you can still do independently, that's still kind of ticking that box as your hobby, right? Technology. So right during this time, I feel like most of us have been trying to be more cognizant of, how do I navigate this, right? How can I get access to all of these different things, right? So there's these virtual trainings like I am doing, right? And presentations. There are different apps that you can use for different things to connect with people. All of these things can be helpful to somebody. These are just suggestions for people to try. Another thing would be is to start a gratitude journal. So gratitude is actually one of the sections in the Compassion Resiliency Toolkit, and gratitude is huge. That is one of those things that it sounds silly and it sounds like, oh yeah, right. But it really actually is helpful if you're paying attention to those positive things in your life. So starting a gratitude journal could be as simple as before you go to bed, write down 3 things that you're grateful for that day, no matter how small, right? So whether it's, I have working air conditioning, I woke up to working air conditioning, I was able to take a shower, and I made myself lunch. I'm grateful for those things, right? Those are small, minute things, but if you do it every single day, it becomes kind of a practice, and it literally will start like retraining your brain and how your thought process kind of works. Because if you're thinking that negatively, or you're going to that negative solution every single time, you're not helping your brain pattern, right? Circle, 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 right? So if you can try to break it to just getting a little bit off course of some sort of hopefulness, positivity, it's breaking that cycle a little bit. Might be dipping back down into the circle, but right, kind of trying to take a detour in a way. So some ways to connect to help in isolation for maybe the aging population, or just in general, right? So telephone calls, right? Text messages, different group chats, literally writing letters. I think that's a lost art. I used to love writing letters to my grandma. My grandma would write letters back and forth to each other, right? That was our way of communicating. But maybe if it's not by mail, maybe it's by email, right? Getting involved with some sort of online interest group. So you might not be able to access, your hobby or your interest off-site or while you're isolated. Maybe you are in isolation or you're in quarantine, right? There are just different online things that you can do. And research, right? And look into, find those groups of people. There's Facebook groups out there. There's message boards. Reddit is a thing. There's different virtual meeting platforms, right? Like we're using Zoom right now. Different live streaming platforms like Facebook Live and like TikTok and Instagram and Snapchat and everything like that, right? A lot of kids and students may be using these things, but this is really the way of how people are connecting. And then freeconferencecall.com, if anyone doesn't know of these, or of this, I should say, is that you can use freeconferencecall.com to be able to connect with family members. So if you're thinking to yourself, I don't know how to do conference calling or how to buzz everybody in, freeconferencecall.com will give you a specific number to call and like a meeting number and a password number that then everyone can be on a conference call, and that's free of charge then. So I think that's super helpful for a lot of the aging population, because a lot of times they just have that phone. So kind of thinking of those things. But if you wanted to chat in the, type in the chat box too, what are some things that maybe you guys are doing in some of your, independent living facilities, or maybe assisted living facilities or nursing homes, any other ways of helping isolate? I know when I was on a call previous to this, they had said that they were doing, if they were working in like group homes and that sort of thing, they were doing, hallway activities in the doorways of things, getting people involved still. Any suggestions that people are using or doing that's been helpful? Put it in the chat. I'm gonna keep on going, but definitely if you think of something or something sparks something that I say, and you have a different suggestion, please put it in the comment box. So technology, like I was saying, right? So those mobile apps that I'm talking about, these 4 are just a small sampling of things that are out there. I personally use Virtual Hopebox, and I use Insight Timer. Virtual Hopebox is awesome for anybody that needs help reminding what's going good in their life and just kind of some positivity. So it's a completely personalized hope box. Now, hope boxes are things that are physical, real things, but then this is obviously a virtual kind, right? So the hope box is kind of filled with all of these kind of feel good things. It's filled with photos and videos of things that you like, that bring you joy. And then it also has ways, there's like, you can click on like distract me, where you just need like, I just need to like play some solitaire. I just need to play some Sudoku. They have those as options. Okay. Insight Timer is actually a meditation app. That one I personally use because I like more guided meditation. You have to be really good at mindfulness and meditation or yoga practicing to really be able to have good skills in mindfulness and meditation. So I really like guided imagery or just a guided meditation. So it just really walks you through an Insight Timer. Again, all of these are free of charge too. So I really try to encourage things that are free because that means that it's accessible to everybody. Okay, some useful exercises that I'm hoping to teach you guys. So this can be used, there's a grounding technique that's called the 5-4-3-2-1. Now this can be used for, keep in mind, again, yourself or for anybody that you're working with in your professional life or in your personal life. So that grounding exercise, and you don't have to do everything, 5-4-3-2, but basically it's 5 things you can see, 4 things you can touch, 3 things you can hear, 2 things you can smell, and 1 thing you can taste. So the first 3 are easy, right? The seeing, touching, and hearing. Those ones are pretty easy. However, when we get into smell and taste, sometimes people are like, well, I don't smell anything, right? Then what I usually do instead is, well, then what's your favorite scent? What do you like smelling, right? And then same with taste. Sometimes it's like, oh, I have coffee on my breath, or, like that's what I taste. Or you could say, if the person's like, oh, I don't taste anything, just say, well, what's your favorite food, right? So that's an example of a grounding exercise of, especially when somebody is in an anxious state or is kind of all over the place. It gets them to refocus their attention on these small things. So even if it is just like naming one thing of those senses or any of the senses that they have the ability to have, because I realize that not everyone can see, not everyone can hear, right? Even if it's just like, tell me 2 things you can see right now, right? I want you to touch three things for me that's in front of you, right? I just want you to touch them, right? And it's just taking that time to do those things. So that's an example of a grounding technique. And again, it gets their mindset out of it. So when I'm talking about that circle and that pattern of thinking, it's trying to break that pattern of thinking. Instead of them thinking about it, they're like, oh, what did you say? Oh, I'm touching this. Okay, I'm touching my tablecloth, right? Oh, I'm touching my mouse, right? All of those types of things. The other thing that I want to teach you guys is this breathing technique. It's called 4-7-8. I really like it. It's super helpful. And the idea behind it is that oftentimes people think, well, if I can just shut off my brain, right? If I can just stop thinking about it, I won't have this sense of panic, or my heart will stop pounding, right? But really, if we can control our physiology and what our heart is doing and our breathing, that's going to affect our brain and our thoughts way more than the other way around. So as an example is this breathing technique. So the example is breathing in for 4 seconds, holding it for 7 seconds or as long as you can, and then exhaling through your mouth for 8 seconds or longer. And then doing this like 2 or 3 times or more. And you'll notice, one, sit down before you do it, especially if you've never done this exercise before, this breathing technique before, because it actually changes like your blood pressure and everything like that. If anybody has a heart condition, they may have been taught this breathing technique before. I was doing the talk before previous, and there was somebody that said they were that they're treated for their heart condition, and they will take their blood pressure before and after doing this to prove to them, like, no, that this really does work, right? So again, if you can control then your breathing, which then will control the heart rate and the pulse, right? Or I'm sorry, the pressure, the blood pressure in it, you're going to be able to slow down your mind a lot more than just trying to think about slowing it down, right? Because that's just another thought that's in your head. So how can you help others? Before I go to that, I would know that there was somebody that threw something out there. So yeah, they have theme days at their place. So for example, Wild Wednesday, everyone wore animal prints and animal ears, and we drew animal faces on the masks, and the residents loved it. That's great. Awesome. Like, these are examples of just bringing in a little bit of joy and something else that they can kind of look forward to. Thinking outside the box, that's what we really need to be doing. So how can you help others during this time and just in general, right? So going back to that, educating yourself, please educate yourself. That's huge. And really just respecting people and listening. So an example of, respect in my eyes and in my line of work is using person first language. So if anyone doesn't know what person first language is that's literally using the person first. So, there's someone who's living with schizophrenia. They're not a schizophrenic. Stop saying schizophrenic. I hate that word. Stop saying schizophrenic. Or stop saying, comparing things, being schizophrenic. That's sometimes, I feel like it's a more popular word from many moons ago. I've never used it. It's never been part of my vocabulary. But if you think about it and you call somebody a schizophrenic, that's really, it's demoralizing, because that's really just defining that person as an illness. We wouldn't just call if somebody had cancer, we wouldn't say, oh yeah, that's cancer over there, right? We wouldn't be identifying somebody by their illness, like, not ever. So, and granted, you may be thinking to yourself, well, I know of some people, or, well, there's a person that I know that talks to himself and walks down the street, right? Well, he's talking to himself, right? He might be experiencing some stuff, right? But if you're calling that person a schizophrenic, I'm letting you know it's not helpful. It's not going to empower them. It's not going to change their mind. It's not going to help them get treatment. It's not going to help them reach out. If anything, it's doing a disservice to that. So helping others by just listening to people vent and hearing them out of what their struggles are, and then resisting that urge to fix or resisting that solution. Because what I was saying before, I truly believe that family members, people think that they're helping when they hear about somebody's problem or their struggle, and they go, oh, wow, have you tried this? Because I've really heard that this is helpful. And oh my gosh, what's really helpful for me is this, blah, 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 right? We do that because we don't like to see humans suffer. As a human condition, we don't like to see other people suffering. So we think we're helping, right? We think they want to hear it from me. They want to know what works for me. They want to, no, like, if you just listen to that person first and use maybe some of those steps of compassionate action, right? You're listening to that person and you're resisting that urge to fix and resisting that urge to suggest something. Remember that they're people first. So this is an example then of how you can support somebody that's struggling with a mental health condition during this time or any time, right? So step one would be, would you like to talk about it, right? Or maybe they're already talking about it with you, right? So you're going to sit and listen without judgment or criticism. That's helpful. That's actually helping people, right? Step two, you're asking, would you like to go out or would you like to do something together? Now you may have to get a little bit more creative with this one because of COVID-19, right? But, going for a walk and being distant from each other, being able to have a cup of coffee somewhere, going out and doing something, right? Step three, asking, well, is there anything that I can do to comfort you, right? Like, oh, well, can I bring you over some soup? Can I bring you over some food, right? You don't have to be physically sick, right? To just get some food from people, right? Anything like that. Sending a card to somebody, right? but asking is kind of the key, right? And step 4, well, would you like me to sit next to you? Or would you want me to leave you alone, right? You're giving that person a choice, and you're asking more about that, right? More about that person. And you're sitting without expectation. You're not sitting there going, oh man, I'm really hoping that this is going to be over in 10 minutes. I'm going to give them some information and they're going to be fine. They're going to pick it up. They're going to get connected, and I'll never have to talk to this person again about this specific issue. No, this is reality. It doesn't really work like that, right? But if you get to that step 4 of asking, would you like me to sit next to you or leave you alone? You're just being present with that person helps. Yes, it's going to feel really uncomfortable for you, and you're going to think, but that's you, right? That's you feeling uncomfortable. And the person on the other end much rather you like just sit in awkward silence than have to try to fix it and think of something to say. You don't have to fill that silence, right? And don't take it personally, please. It's tough. It's really something tough, but don't take it personally. If they say that, no, I just want to be left alone right now, they may just need time to kind of recharge themselves. So here are some of the resource numbers and websites that I wanted to refer to you guys some of them I've referenced throughout the presentation. Others are just, here. Again, like I said, you'll be getting this PDF after this presentation. I'm going to be sending it to Pam, and she's going to get it out to you guys. But NAMI, as a NAMI National, actually has a helpline. So it's an 800 number. And basically, if you may be thinking to yourself, oh, that NAMI sounds great, but the person that I want to give it to, they don't have access to a computer. And obviously that's the easiest way to get connected with something, right? They can call the NAMI helpline and be like, hey, I just heard of NAMI. Like, is there a local affiliate near me, or what's offered, or what do you guys do? Or, hey, I just got done with this presentation. I don't know what to expect, right? Here's my situation going on. They'll be able to sit and talk with you. And that being said too, local affiliates and state affiliates are able to do those things too. They're able to take more time with people to be able to talk out situations, to really be able to point them in correct directions, so they're not left in the same situation, basically. And I know at our office, we even say, like, if that doesn't work for you, please call us back and tell us that it didn't help, or, it wasn't what you thought it was, or whatever, because then that helps us be able to refer, make better referrals for people. So the Suicide Prevention Lifeline, this can be used for somebody that's in crisis that didn't even necessarily say, I'm having thoughts of killing myself or anything like that. Or this line can also be used and called if you're concerned for somebody, if you're a family member and is like, I don't know what to do about my 22-year-old anymore. She's had this many attempts and there's self-harm happening. You don't know what to do, right? You can call the Lifeline as well. The Suicide Prevention Lifeline. This isn't just for the people that are going through it. They support family members as well. And most, if not all, actual like crisis lines, support lines, and helplines, it's not just for the person, it's for people that are affected by that then too. So keep that in mind. Texting that 741-741 number, that 24/7 number, right? Just for support. They can be in crisis, or they could just be like, I don't have anybody else to talk to, so I need to tell somebody about the really cool stuff I did today, right? I give that out to students a lot of times, especially if it's the kids that say, oh, well, I don't have any friends, when they're told, oh, well, just go play with your friends or go talk to them, right? And they go, oh, well, I don't really have any friends, right? I give them this text line number and say, please text them, right? They are there to be there for people. So I know, so I'm kind of winding down a little bit because it is about 2:20 and I want to leave some time for any questions that people have. But during this time too, if people have questions or any feedback, put it in the chat box, then I can start commenting on it too. So just some resource websites that I've mentioned, some of them throughout, which is NAMI, the National Alliance on Mental Illness. NAMI.org is a huge resource to educate yourself. If you're a member, you do get access to those discussion groups online. Mental Health America is an awesome website, also has great programs, great facts, great education on their website. Depression and Bipolar Support Alliance, they also have a website and are also offering online support groups during this time. That being said, NAMIs nationwide, some of them are offering support groups online. Like my affiliate, like I mentioned before, we're actually offering a parent peer support group online right now. And then we're offering our family support group online right now. And then also that Compassion Resiliency Toolkit, something that I definitely would like you guys to, you know, read through, watch some videos. I would love it if you took another lunch hour like this and then just focused on the Compassion Resiliency Toolkit. I think that would be, you know, super helpful and kind of learning more from what I was able to discuss. And that is it for me. So I want to thank everybody for attending this. I hope that you got something out of it. I want people to know that they are not alone, whether it's themselves going through something, or you may be thinking, you know, I have a family member or a friend who is struggling with this, or I work with my clients that are struggling with these types of things. Please educate yourself, gain a little bit more insight into, you know, how they're doing during this time, what's going on with them. And if you feel like you're struggling yourself, please reach out for help. Like I said, it doesn't have to look like just one thing. It doesn't just have to look like talking to your doctor. You start with a friend first that you trust, because sometimes just venting is really helpful then in general. It doesn't work for everybody, but sometimes that's all that that person may need, especially if it's an acute situation. So thank you very much for being here. I will definitely take any questions.
Any questions from the audience out there?
Thank you, guys.
Great. Sarah, it was wonderful information. I think for anyone at any level of caring for others and professionals and families, there was something for all of us to take away and help those that we're trying to serve. For all of you, thank you so much for joining. And don't forget, we have our virtual road trip in June. We'll be welcoming Benjamin Sermi, social gerontologist with Kelch Communities. He will be talking about rising up, creativity, and hope on the front line. So great information. He too is an engaging speaker like Sarah. And so we invite you all to be connected to all these webinars that we're doing right now to help all of you with education and resources. And we will be sending this out as a link. And so again, thank you, Sarah. This was great information and much needed, especially now.
Awesome.
Everyone have a great day, and hopefully we'll see you again soon. Thank you.
Thanks.